Proff exams, and NEET PG and FMGE exams. Practical sessions will be also be included so that you will have hands-on experience and you can face the examiners with so much confidence that you will be knowing the answer and how to tell the answer and how to react for the answer. All these are provided in 4 plans, that is foundation plan, which is available at 19,999, and we have advanced learning plan at for 6 months at 32,999, and complete learning plan for 12 months at 15,999, and we have ultimate MBBS plan, which is 1.9 lakhs. And not to get disappointed, we'll be having good discounts. Please do use the discount code displayed below for good discounts. With this, we'll start with case scenario, that is juvenile delinquency. Okay, a 15-year-old boy named Raj lives in an urban slum with a single mother and 2 younger siblings. His mother works for long hours as a domestic help to support the family, and Raj has struggling in academically and has history of truancy. Recently has been spending more time with a group of older boys known for involvement in petty crimes. One evening, Raj and his friends are caught by police while attempting to steal a motorcycle. Raj is taken into custody and charged with attempt to theft. This is his first encounter with juvenile justice system. And MCQs I'll be skipping now. The first question is juvenile delinquency causes and preventive measures. What does juvenile mean? Juvenile means a boy who has not attained the age of 16 years and a girl who has not attained the age of 18 years. It is different for gender. What does juvenile delinquency mean? The Child Act of 1960 in India defines delinquent as a child who has committed an offense. It does not define it as a crime. It defines it as an offense. Okay. What are the causes? There are biological causes, social causes, and other causes. Biological causes, it could be hereditary, feeble-mindedness, that is weak-mindedness, physical defects, glandular imbalance, that is hormonal imbalance, may be the bottom of the juvenile delinquency. However, recent studies indicate that chromosome anomaly might also be associated with this. A survey of criminal patients in Scotland demonstrated some patients of showing extra Y chromosome have severe disturbance of whole personality. Okay, this is one of the studies which has been done. Social causes, single parents, broken homes, problem families, separation of parents, stepmothers, disturbed home conditions, and associated with poverty, parental neglect, ignorance, abuse, too many children, difficult to manage. All those things are the social causes which are responsible for juvenile delinquency. Other causes are, it is done for recreation facilities. When people don't have recreation, they do this. There's something called kleptomania also, where stealing a small things which even they're affordable. Okay. This is cheap recreation, sex thrillers, urbanization, industrialization, unable to get the recreation at the higher cost, so they'll find it at the lower cost by doing all these things. How do we prevent this? This can be prevented by a well-adjusted family, and parents should be prepared for parenthood, and the needs of children should be appreciated and met. Not all the needs as per the requirement and the affordability, and they should be made to understand the affordability. School plays a very great role to modify the behavior of the children. There should be a healthy teacher pupil relationship. Healthy student teacher relationship plays a very great role. How they can identify the maladjustment problems, early signs, and they can modify, or they can be treated. If they cannot be modified by the teachers, it can be treated by the medical personnel. Okay. Social welfare activities, recreation facilities, couple counseling or parent counseling, child guidance, educational facilities, and adequate health services. These are the services which can, social services which can prevent juvenile delinquency. Okay. It is three people, that is three aspects. One is parent and child. Second, that comes to the family. The other one is schooling, and other one is the surrounding environment. Coming to the next question, we have primary prevention of disabilities in handicaps. Primary prevention of focuses on preventing of the onset of impairments or conditions that may lead to disability, reducing the risk of individuals becoming handicapped. Okay, now it is called physically challenged. Nowhere the handicapped word is used, it is called challenged. Even mentally handicapped has been replaced by mentally challenged, or they are differently abled. Various strategies have been aimed to improve the health and social determinants, which we'll see in the coming slides. Like public health measures, vaccination programs such as pulse polio immunization, Mission Indradhanush, which includes rubella, JE vaccination for meningitis. So all these lead to disabilities which can be prevented by vaccination. Coming to the prenatal care, promoting adequate maternal care during the pregnancy and nutrition can prevent congenital anomalies. Injury prevention by road safety, workplace safety and programs, all these things can prevent the injuries. Health education, promoting awareness about lifestyle choices. Cessation of smoking during pregnancy, providing healthy diet and good exercise during the pregnancy, not the over exercise or very strenuous physical activity. That again depends on more nutrition requirement. All these things can reduce the risk of chronic diseases. Okay. And genetic counseling. If the people have got married in the relationships, that means in the first order relatives or the second order relatives, the genetic counseling is a must for the couple, so that the genetic abnormalities which get expressed as physical abnormalities or congenital disabilities can be avoided. Environmental and occupational safety. If the mother is working in a chemical factory, again she is exposed to certain chemicals which lead to disabilities like lead poisoning, mercury poisoning, all these things. Access to healthcare, ensuring early diagnosis and treatment of conditions. Who does this? It involves both mother and the ASHA worker, ANM, aid, Anganwadi workers, all these things. All these people play a very important role in accessing the healthcare. Nutrition program, there are many programs like ICDS, midday meal program, support of iron and folic acid. All these things are provided in the nutrition programs to provide extra nutrition and supplementary nutrition for children and pregnant women and lactating women as well as adolescents also. There are mental health programs are also available in the government of India, so that early intervention programs and community mental health support to provide conditions that cause long-term disability. Okay. Third, we have baby-friendly hospital initiative and its characteristics. Before going to this question, we'll see the poll. It has been already 10 minutes. I'm ending this poll and starting the second one. Okay. What is baby-friendly hospital initiative and its characteristics? This is a short note as well as a short answer. We'll see as it has a number of steps what are involved in this. It was launched in 1991 by UNICEF and WHO both. It is a motivating factor for maternity facilities around the world. Okay. By how? By implementing policies and practices. What are the goals? To transform hospitals and maternity facilities through implementation of 10 steps, which we'll be discussing in the subsequent slides, and to end practice of distribution of free and low cost breast milk substitutes to maternity wards or hospitals. This is the goal. Two goals which are most important. One is to implement the 10 steps which we'll be discussing, and to end the practice of distribution of free and low cost milk supplies, substitution of infant breast milk substitutes. Coming to the 10 steps, first we have hospital should have a written breastfeeding policy that is routinely communicated to all healthcare staff. Written policy should be there. And once you have written policy for staff, that staff should be trained in the necessary skills to implement that policy. Okay. Once you have trained the staff, the third step is the trained staff should inform all the pregnant women about the benefits and management of breastfeeding. Okay. This is the third step. After this, once it is explained, help the mothers. It is just the sequence which you are learning in this question. Help the mothers initiate breastfeeding within half an hour of birth. Try for this. Okay. And place babies skin to skin contact with their mothers immediately following birth for at least 1 hour so that mother would recognize when their babies are ready to breastfeed and offer help if needed. If the trained staff should help if it is required. The fifth step is show mothers how to breastfeed and how to maintain lactation even if they should be separated from their infants for any medical reasons. Okay. After that, you educate the mother not to give food or any other drink other than breast milk unless if it is medically indicated. Nothing else apart from this. Practice rooming in. Allow both child and mother to be in a single room for complete day. Encourage breastfeeding on demand. And after feeding is done, everything is done, you tell them not to use any artificial teats or pacifiers to breastfeed the babies. Okay. To breastfeeding infants, when they're on the breastfeeding, they should not be given any teats or pacifiers which are kept in the mouth. Okay. And to foster the establishment of breastfeeding support group and refer mothers to them so that they continue to get the knowledge of advantages of breastfeeding and they get attached with that group. Okay. These are the 10 steps in BFHI. If you explain these 10 steps in your own words, it becomes a short answer, short note. Okay. Next, we have indicators of MCH care. This was discussed earlier also, and we'll be revising it again. They're classified into 3 types: mortality indicators, morbidity indicators, and growth and development indicators. If you classify and write, it will be very easy and you'll be getting a full mark without doubt. Maternal indicators are maternal mortality and ratio. In maternal mortality ratio, the denominator is live births, whereas in rate, the denominator is the age specific group of females is summed up. Summation of age specific group females in the reproductive age group. Okay, this you should know. Indicator during infancy, perinatal mortality rate, neonatal mortality rate, post-neonatal mortality rate, and infant mortality rate. Okay. The previous slide was also type of classification. This is the other type that is based on the age, that is pregnancy, immediately after pregnancy, and that is infant age group and childhood age group. During pregnancy, it is maternal mortality rate and ratio. During infancy, it is perinatal, neonatal, post-neonatal, and infant mortality. Okay. During childhood, it is 1 to 4 years, under 5, and child survival rate. These are the 10 indicators which you should remember for a 3 marker. Right. Next, we have the problems of school age group and how are they being addressed. School age children face n number of problems which neither parents can identify nor the teachers will identify them. They face physical, emotional, social, and cognitive challenges. Physical health issues which are coming up as of now are obesity, the most common one. If the child is chubby, doesn't mean that the child is healthy. It means the child can be obese also. Why? Because of poor diet. Poor diet does not mean that less food, over food, lack of physical activity, excessive screen time. How do we address this? Promoting physical education, healthy meals and campaigns, balanced diets and exercises. Infectious diseases, contagious diseases like flu, measles, and chickenpox, again, immunization, hygiene, and regular screening at the schools. And we have mental health issues also, which are commonly neglected in India. Those are anxiety and stress, peer pressure. You have to get first rank. That is one of the thing. Okay. Academic pressure, bullying, family related issues like separated families can cause stress and anxiety. School counselors, mental health programs, relaxation techniques, and inclusive school environments, all these things provide, can be addressed by all these things. Attention deficit hyperactive disorder is becoming most common nowadays. Unable to focus, but the child is very active, but he's not able to do one thing. He or she is not able to do one thing. They does multiple things in very short span of time, but nothing is complete. Attention deficit hyperactivity disorder, specialized educational plan, behavioral therapy, all these things can be done to address those issues. Learning disabilities, dyslexia, dysgraphia, and dyscalculia. Okay, difficult to pronounce, difficult to write, and difficult to calculate. All these things can cause frustration and sense of inadequacy in children. Early screening in schools, individual support plans, and extra time on assignments, all these things can be used for addressing this. Social issues like bullying, peer pressure, exclusion, all this been faced and been addressed. But addressing is the question, how is it addressed? Whether the child who is complaining or bringing out that issue is addressed, or the person who is doing it is addressed, is a question. Okay. Anti-bullying campaigns in the school, peer support systems, and zero tolerance policies at the schools. You don't take out the person who got dragged. You actually address the person who is dragging. Okay. Peer pressure, again, attitudes, actions, all these things come in. But empowerment programs for teaching assertiveness and critical thinking also is important. Okay. Screen and addiction and reduced outdoor play. This is the upcoming problem of children due to the vast advancement and the sudden advancement in the technology. It can be done by parents promoting outdoor activities and encourage hobbies like sports and setting daily limits on screen time in schools and families. This needs to be addressed. Poor academic performance, again, all these factors leads to this. Again, tutoring programs like after school tuitions, parent teacher cooperation like PTM should be conducted regularly to identify the risk individuals, and additional care and support should be provided for children who are not performing well in the academics. Nutritional deficiencies include anemia, stunted growth, and cognitive delays and malnutrition. In government schools, there's a free school programs. ICDS is also there for 0 to 6 children. And nutrition education parents for children. Midday meal program is provided to provide some supplementation of nutrition. Sleep deprivation, usually because of the screen time and irregular schedules. And setting up of a routine for a child would reduce the sleep deprivation. Okay. Parental pressure, again, to get good marks, that you should address the parents, saying that getting good marks doesn't mean that child is doing well in their life. It should all explain to them that child has a limitation of its own and it can perform it to a certain capacity, and pushing that beyond that capacity has its own disadvantages. Coming to the last one, that is substance abuse. It is in their age group. How do they get influenced because of all the problems they might go into substance abuse? This can be done by giving parental counseling and explaining the children about the use of strong substances. With this, I'll be stopping the second poll. It is already 10 minutes. Coming to the next question, that is Anganwadi worker and what are the functions? Anganwadi workers are the grassroots level workers and they function under ICDS. Okay. They play a very critical role in managing, improving the health of mother, pregnant mother, child, lactating mother, and adolescents. All these are included in this. Okay. Health and nutrition services, growth monitoring, 0 to 6 years of age, supplementary nutrition by giving nutrition to under 6, lactating mothers, pregnant mothers, and all adolescents. Health checkups and referrals, they mobilize the mother and child for their health checkups and referrals for immunization also when it is due. And they also refer the sick and malnourished children to the nearest health facilities. Nutrition and health education, based on nutrition, breastfeeding, hygiene, and overall healthcare, they are educated. Immunization, that is, they will be mobilized as per the vaccine due date so that the immunization is running on schedule. Preschool and non-formal education for the child as aged 3 to 6 years is provided to Anganwadi. This includes like games, songs, and learning through play. Cognitive and social development is also by mingling with children, giving them skills to enhance their ability. Maternal and child health, who are included in this? Pregnancy care, like ANC care, educating about childbirth, nutrition, postnatal care. So many women come in so that they get educated about how to bring up the child, also how to manage during antenatal care and what are the precautions to be taken. Postnatal care, about breastfeeding, immunization, and newborn care. Family planning methods for the couples who have already one child. Mobilization during pulse polio immunizations and educating about the same. Women empowerment about these schemes like Janani Suraksha Yojana, Matru Vandana Yojana, all these things are explained through Anganwadi workers to the mothers. And they do visit home visits to track the health and nutrition of the children. Okay. Implementation of government programs to support all the other functions, that is JSY, Matru Vandana Yojana, and Poshan Abhiyan for nutrition. And they also maintain data for all these things, whatever they do. These are the 5 broad categories of functions. At least 2 functions are there. You will be getting complete marks if you remember all the 5. And they do coordinate with other agencies like other health workers like ASHAs and health workers and nutrition department to get the things done. Okay, and educational department also. Counseling for families regarding the family planning methods, sanitation and hygiene, and support during emergencies while shifting the pregnant mother to hospital or getting them back from hospital to their village or hometown. All this support during the emergencies have been done by Anganwadi workers. The last question we have for us today is, how do you manage postpartum hemorrhage in community healthcare setting? What is postpartum hemorrhage? Is the leading cause for maternal mortality. Okay. Whenever it occurs, you shift the patient to the healthcare setting for management. First, identification of high risk mothers by antenatal screening by using all these Anganwadi workers, ANMs, ASHA workers, etc. Who are the high risk work categories? Anemia, history of previous PPS, multiple pregnancies, prolonged labor, uterine atony. All these things are high risk patients. How are they screened? By regular monitoring or ultrasound or doing the blood sample examination. CBC is the basic thing which can give you so many solutions for a smaller test. Active management of third stage labor is a key intervention. Oxytocin administration, 10 units within 1 minute of delivery. Controlled contraction if it is a normal delivery, and uterine massage. Okay. Initial management of PPH, assess the blood loss first. 500 ml after vaginal delivery of 1 liter after cesarean section considered to be PPH. Give us slow and good massage to the uterus. Inject oxytocin. Bimanual compression if the uterus does not respond to the massage. Okay. And ensure that bladder is empty so that the massage is perfect. After assessing and after doing all these things, please do refer to the higher center where there is a surgical facility available and blood transfusion facilities available. By how? Contact the 108 emergency ambulance services or Janani Suraksha Yojana vehicles in India they do the emergency shifting of the patient. Okay. Referral checklists should be maintained so that the woman's condition, blood loss or and uterotonic administration and vital signs and HB, all these are already provided with the patient so that the same things does not get repeated at the higher center. They don't have to start from step one. Management during transport in the ambulance, monitor the vital signs, administer intravenous fluids, and communicate with the higher referral center so that they will be ready for taking the patient in. Fluids of choice is ringer lactate and normal saline. Priority one is ringer lactate, second one is normal saline. Postpartum care and follow-up. It is more important. A&M and Asha should visit the mother to see that there are no other signs of PPH and she's recovering well, and monitor her hemoglobin levels, vital signs, and overall well-being of the mother. Iron supplementation should be provided so that their hemoglobin level gets increased. Education and training. Whom will you educate and train? ANMs, ASHAs, and Anganwadis to identify what is PPH, how does PPH happen, what are the things can be done by them at their level, and how do the referral protocols happen. Community awareness by recognizing, educating the families and communities to recognize the signs if no skilled attendant or the skilled trained person is there with them. Okay. Community level preventive strategies, educate that all the deliveries should happen at a hospital. JSY is available to provide the services, and nutritional support is provided through ICDS and other programs to maintain adequate nutrition folic acid in the blood so that their HB is maintained. Okay. With this, we'll be completing today's class. Thanks for watching. And we have 4 social media handles of Auricle, that is YouTube, Instagram, Facebook, and Telegram. And we have apps on Android as well as on App Store for iOS users. Thanks for watching. See you in next class.